As we go into the meeting, I just want to read the public comment statement. Any citizen desiring to address the hospital board should turn in speaker card to the board secretary. Right over there, Ms. Karen. If the citizen comment pertains to an item on the agenda today, the comment will be heard early in this meeting. Otherwise, it will be heard towards the end. Speakers are asked to limit their comments to 5 to 3 minutes. If we have over 10, we will do 3. If we have under 10, we will do 5. Vendors, suppliers, or other people seeking hospital contracts awarded on a competitive basis are reminded that their ability to address the board may be restricted by the terms of their invitation to bid, request for proposal, or other purchasing criteria. Lastly, the board has established a claims adjustment review panel comprised of representatives of the board, the medical staff, administration, and the legal counsel to review and negotiate the settlement of claims. Accordingly, the board will not entertain comments or discuss or negotiate claims at this meeting. With that said, I'd like to call our meeting to order. Can I get an approval of the orders of the day? Second. All in favor, say aye.
Aye.
And can I get an approval of the minutes of the meeting on March 25th, 2025?
Second.
All in favor, say aye.
Aye.
Motion passes. With that, we have our board report. No board reports, so we're just going to go right into our Excel workbooks.
Thank you, Madam. Thank you, Madam Chair. I have 2 Excel Award winners today to recognize, and I'm not 100% sure they're here. Is Wilfred Nazario? Are you here?
Right here.
Come on up. Sorry, didn't see you there. I'm going to say some good things about you again. So I want to introduce our Excel Award winner for March, Wilfred Nazario, our patient care representative 2 in nuclear medicine. Will has been with the hospital since 2006. It's a great year. It's a year I think I made that joke earlier. Yeah. Colleagues describe Will as the glue that keeps the team together. He's a great collaborator who goes far and above and beyond for our patients. To save time and improve the patient's experience, he coordinates with nuclear med techs, the echo department, and registration. His warm and reassuring attitude helps patients feel welcome and cared for. Will also has a great sense of humor and brings a smile to everyone around him, and he goes out of his way to help with his team. When nurses are busy, Will help prep the rooms. Staff consistently express their gratitude for him and appreciate all he does for the department and the patients we serve. Will, thank you so much on behalf of the hospital, our community, and all our staff. Thank you very much.
Okay, thank you.
Is Mary Beth with us? Yes. Mary Beth, come on.
Let's go. Sorry.
Congratulations again. Thank you. You say something. Next up is our Excel recipient for April, Mary Beth Basanko. Did I get that right? Okay, thank you. A nurse professional development specialist. Mary Beth has been at the SMH since 1992, and 20 of those years have been in the nursing education department. Throughout her tenure, she has taken on a variety of responsibilities that includes ACLS and BLS, nursing orientation, educational workshops, student liaison, and most recently supporting our international educated nurses. She has done a remarkable job in all of those roles, helping our nurses transition to SMH, boosting their confidence, and instilling a lifelong love of learning. She is a role model for providing the highest level of patient-centered, patient-safe care. Mary Beth is also described as a wonderful communicator who truly inspires everyone to be the best they can be. Outside of work, She provides a great deal of support for international nurses, helping them find housing, furniture, or anything else they may need when arriving here. She's taken them out to dinner and even opened her doors of her own home to RNs seeking lodging. As one grateful nurse said, "I am forever grateful to meet such a kind and generous soul. Mary Beth stands out as a remarkable and dedicated individual, and her wisdom will always guide me." Thank you very much for being here.
I thank you, Sarasota Memorial Hospital, for the whole 35 years and for all the support and everything that they had provided for me as well.
Congratulations and thank you. Next on our agenda is our medical staff reports. Dr. Burgess.
Madam Chair and members of the board, today I'm asking for a motion to approve the SMH Sarasota policies, guidelines, procedures, and forms, including the SMH Sarasota anesthesia privilege form, SMH Sarasota infectious disease privilege form, the SMH Sarasota nephrology privilege form, the SMH Sarasota advanced practice provider outpatient structural heart cardiology, and the SMH Sarasota sleep medicine multidiscipline, multi-specialty privileges which are being archived. All of these have been recommended by the SMH Sarasota Medical Executive Committee.
Can I get a second? Second. All in favor?
Aye.
Any opposed? Motion passes. Thank you so much. Dr. Fair, would you like to go over yours?
Thank you, Madam Chair. Good afternoon, Hospital Board. Today I'm asking for a motion to approve the SMH Venice policies, guidelines, and procedure forms, including the SMH Venice anesthesia privilege form, the SMH Venice infectious disease privilege form, and the SMH Venice nephrology privilege form, as recommended by the SMH Venice Medical Executive Committee.
Oh, sorry. So moved.
Can I get a second? All in favor, say aye.
Aye.
Motion passes. Next on our agenda, if Secretary Patty Mariah will read her report.
Okay, for my secretary's report, I'd like to make you aware of the upcoming meeting dates for June and July. They are Tuesday, June 24th, 2025, 9 to 9:30, closed session, hospital board meeting, 9:30 to 10, quality committee. On Tuesday, July 8th, 2025, 8:30 to 11:30, strategic planning retreat, closed meeting. And Tuesday, July 29th, from 9 to 10:30, joint finance and audit committee, 10:30 to noon, governance effectiveness committee, noon to 12:30, closed session hospital board meeting, 12:30 to 2, board lunch issue and financial review, and 2 p.m. to 4 p.m. board meeting.
Thank you so much. Next on our agenda is Kevin Cooper, our treasurer.
Thank you, Madam Chair. There's one item under my section, which is the approval of bad debts and charity care. And I move approval of the bad debts and charity care for the month ended March 31st, 2025, in the amount of $23,879,000. And for the month ended April 30, 2025, in the amount of $31,067,000.
Thank you, Kevin. Can I get a second?
Second.
All in favor, say aye.
Aye.
Any opposed? Motion passes. Great. Next on our agenda is our Chief Financial Officer, Jen Wasabi, to go over her report.
Thank you. Good afternoon. I'm going to be presenting the financial results for the month of April, as well as the first 7 months of our fiscal year. Total revenue month to date. Total revenue month to date, actual results, $196,981,000 versus a budget of $174,040,000. Year to date, $1,245,362,000 versus a budget of $1,237,430,000. Total expenses for the month of April, $172,686,000 versus a budget of $164,638,000. Fiscal year-to-date expenses, $1,141,951,000 and a budget of $1,167,473,000. Our operating income for the month, $24,295,000, resulting in an operating margin of 12.3% on a budget of $9,402,000, operating margin of 5.4%. Fiscal year to date, operating income, $103,411,000, resulting in an operating margin of 8.3% on a budget of $69,957,000, resulting in an operating margin of 5.7% for the budget. These are the April fiscal year-to-date statistics. Average daily census actual of 956 versus a budget of 961. The Sarasota average acute length of stay of 4.48. Venice average acute length of stay of 3.77. Our fiscal year-to-date admissions and observation cases are actual 51,136 on a budget of 50,280. Continuing with our fiscal year-to-date statistics, surgery cases, actual 20,080, budget of 20,418, total births of 2,743 versus a budget of 2,781. Our outpatient registrations, fiscal year-to-date, 366,313, versus a budget of 365,524. ECC registrations, 108,203 versus a budget of 107,677. And the case mix index for Sarasota CMI all 1.88, for Sarasota CMI Medicare 1.96, Venice CMI all 1.48, and Venice CMI Medicare 1.48. And that concludes my report.
Thank you so much. Earlier today, we met with two committees, Human Resources and Mission and Planning. So we are going to hear those reports right now. Human Resources, Pam Byklid.
Thank you, Madam Chair. The Human Resources Committee met this morning. After approval of the minutes, Lori Bennett, the Vice President of Human Resources for the hospital system, provided an update on labor trends nationally and locally. It was noted that the trend is for strong growth in the healthcare industry, where we face a competitive labor market. Partnering with local schools, veterans organizations, and events has helped increase our success in recruiting. As the largest employer in Sarasota County, it's essential that we retain those we recruit, our organizational culture, our competitive compensation, a work-life balance, and career development opportunities critical to our success. A strategic plan in HR's organizational structure is underway, so SMH can stay viable in its staffing and retention efforts as the hospital system continues to grow in depth and breadth throughout Sarasota County. That concludes my report.
Thank you so much. If nobody has any questions for Pam, we will move on to Cher.
Thank you, Madam Chair. The Mission and Planning Committee met this morning. There were two recommendations for approval presented to the committee. In the first presentation, Jeff Westner, Chief Operating Officer at SMH Venice, and Jan Vera, Chief Financial Officer at SMH Venice, gave an update on the capacity challenges within the current radiology department at SMH Venice. Due to the significant acute care growth at SMH Venice Hospital over the past 4 years, both interventional radiology and MRI have exceeded their capacity. The proposed radiological expansion project would increase the services by 1 interventional radiology and 1 MRI, 2 ultrasound procedure rooms, 14 prep and recovery beds, and other radiology support space. The radiology expansion is expected to open for patient care in the fall of 2026, subject to normal project adjustments. At this time, I move approval of the funding for the Sarasota Memorial Hospital Venice Radiology Expansion Project in the amount not to exceed $29 million as recommended by the Mission and Planning Committee, subject to normal project adjustments.
So moved.
We have a motion and a second. All in favor, say aye.
Aye.
Any opposed? Motion passes.
Next, Frank Morgan, Chief Operating Officer at SMH Sarasota, and Dr. Joseph Seaman, Associate Chief Medical Officer at SMH Sarasota, presented on the electrophysiology capacity challenges at SMH Sarasota. Over the past 5 years, electrophysiology volume increased over 100%. The high patient demand and limited procedural capacity offers new opportunity to increase access to care in the cardiology department. So the cardiology expansion project would increase the EP electrophysiology procedures by 2 labs, up to 20 additional pre and post bays, and increase cardiac support space. The cardiology project would use a phased approach due to the renovation logistics and open for patient care in fall of 2026 for pre and post bays, and the summer of 2027 for additional EP labs, subject to the normal project adjustments. So at this time, I move approval of the funding for the Sarasota Memorial Hospital Sarasota Cardiology Expansion Project in the amount not to exceed $30 million as recommended by the Mission and Planning Committee, subject to normal project adjustments.
Second.
Okay, we have a motion and a second. All in favor, say aye.
Aye.
Any opposed? Motion passes. Great.
And
Thank you.
that concludes my report, Madam Chair.
Thank you so much, Sharon. Next up is David Barringer, give his president's report.
Thank you, Madam Chair. I'm going to see if I can do this. There we go. Okay, so looking at our organizational report card, as we do each month, we look at the 5 areas of focus that we have in our organization: service, people, quality, finance, and growth. Then we look at our goal, and finally the score that we have, that we are on for our year to date. So the first being that is service. We look at our likelihood of recommending, and we try to have 8 out of 10 of the areas that we survey be at or equal to or greater than the 75th percentile. I'm happy to report that all 10 of the areas are reporting over 75th percentile positive. So we'll see the details on that in a minute. And the second area is that of people. We look at our new hire retention, a percent of regular full-time employees hired in FY 2025 that are still employed as of September 30th, 2025. We have a goal of having 83% or higher in that. We are trending higher than that right now at 91.24%. In the area of quality, we have our infection prevention, which is our combined overall standardized infection rate, be less than 0.8. Happy to report we are doing great on that as well at 0.51. And just to remind the board that 1.0 would equal the national average, so we are good. We already set our goals a good bit under that. In the area of finance, we've already heard from our Chief Financial Officer, Jen Rosati, but we do have this as one of our areas of focus, having our operating margin be at our budget or greater, which our budget's at 5%. We are trending higher than that at 6.6%. And in the area of growth, we have 2 goals, one being our inpatient admissions and observation outpatients being at 82,000 or higher. We're trending higher than that at 85,000. And the second being our outpatient registrations, which The goal is 1.224 million, and we are trending higher than that as well, 1.324. Next, looking at the details of the patient experience report card. In the left-hand column, you see the 10 areas that we survey. In the middle being the actual score that we have. The next column over being the national median score, and then finally to the far right being the 75th percentile score. As I indicated a minute ago, all 10 areas that we survey right now are exceeding equal or exceeding the 75th percentile. Next up is SMH campuses maintain top marks on latest Leapfrog report. On the most recent Leapfrog group report cards, SMH Sarasota continued a straight A streak that has held since 2016, while SMH Venice earned its third consecutive A grade since becoming eligible for the review. Issued in the spring and fall of each year, Leapfrog assigns the letter grades A, B, C, D, and F to hospitals based on their ability to protect patients from medical errors, accidents, injuries, and infections. An independent rating agency, Leapfrog bases its safety grades on hospital survey data and patient safety outcomes and measures obtained from the Federal Centers of Medicare and Medicaid Services. SMH unveils the state-of-the-art Kachowski Research and Education Institute. Hope you're all enjoying it today. It's our first meeting here. Sarasota Memorial completed the much-anticipated Kachowski Research Education Institute last month. The 5-story facility on our SMH Sarasota campus brings research, clinical education, and physician residency and fellowship programs together under one roof, freeing up much-needed space inside the hospital for patient care. The Institute is named after Jerry and Karen Kachowski, whose $25 million gift to Sarasota Memorial Healthcare Foundation was a catalyst for its construction. The donation was the latest in a series of generous gifts the Kachowskis and their family foundation have made over years to help SMH expand research and education opportunities. SMH supports leading-edge innovation. Studies of promising treatments and recent technology advances include the following. Sarasota Memorial has joined 30 research sites to test the efficacy of an experimental immunotherapeutic drug targeting resistant late-stage ovarian cancer. SMH is evaluating an investigational device designed to reduce bleeding and complications in patients undergoing dialysis. SMH is one of 10 research sites enrolling those patients. Sarasota Memorial's heart team is among the first wave of physicians using a new FDA-approved treatment that replaces failing tricuspid valves in high-risk patients. And Sarasota Memorial's neurosurgical team is pioneering the use of Apple Vision Pro's mixed reality headset with revolutionary mapping technology. It enhances the surgical coordination, efficiency, and precision, ultimately reducing delays in the amount of time spent in the OR. We also had the opportunity to celebrate our staff service. So Sarasota Memorial recently honored more than 790 employees, marking milestone work anniversaries from 5 years all the way up to an incredible 45 years of service. This year, 28 staff members reached the remarkable milestone of 30 years or more with SMH team. I just thank all of our staff for being there. Beautiful night. On Doctors' Day, SMH honors past and present physicians. Doctors at Sarasota Memorial recently recognized Doctors' Day with a special ad, a video, social media, and a digital sign displaying thanks to our incredible physicians for their outstanding work and a critical role they have played throughout our SMH's 100 years of service. We also had the opportunity to celebrate our nursing team. Sarasota Memorial joined the nation in celebrating Nurses Week, May 6th to the 12th, a time to appreciate the exceptional dedication and patient care provided by more than 3,500 nurses throughout our entire health system and the 1,100 patient care and multi-skilled techs who support nursing care. Our campus has held a full slate of activities, including special events honoring our 2025 nurses, PCTs, MSTs of excellence. For the past 22 years, SMH Sarasota has been continuously recognized as one of the best nursing organizations in the U.S., earning Magnet designation, the nation's highest honor for nursing excellence, 5 times. SMH Venice has embarked on its own Magnet journey, and some more to come with that one. And finally, we get to recognize our incredible volunteers. National Volunteer Week was April 20th through the 26th, a time to share our appreciation for the tremendous service provided by over 700 volunteers on our 2 campuses. Last year, volunteers contributed 120,000 hours of service throughout the health system. As we celebrate Sarasota Memorial's 100th anniversary this year, we're grateful for the important part of our volunteers have played in making SMH a better place for patients, staff, and the community. Madam Chair, that is my report. I'm happy to answer any questions.
Thank you, David. Does anybody have any questions? Okay. Hearing none, we will move on to our public comments. Because we have 6 speakers, each speaker will get 5 minutes. I do ask that you follow the rules of civility that you signed before, or that you agreed upon when you came in. I will not interrupt you, but the time will be on the board, so hopefully you guys can all abide by that. With that said, we will start off with Mary Steiner, followed by Jim Tollerton.
Mary Steiner, Sarasota taxpayer. Recent encounter with SMH. On Tuesday, April 1st, 2025, I had my annual visit to the cardiologist. This doctor was new to me as the previous one had retired. After being in the treatment room, this doctor came and said I had to go to the ER immediately. I thought that my pacemaker's nightly report transmission had reported something from when I had that dizzy spell the day before. Wrong, and was from March 1st, 2025, where I had an NSVT of less than 30 seconds, which I found out about on my quarterly remote transmission, where the report said I was doing okay and to continue as I was, so I knew it was not an emergency. At that time, she mentioned I needed that surgery where they put a needle in your vein near my wrist and somehow get to my heart and find the blockage. Now on my chart, there's no mention of this surgery. I told her it was time for me to have some tests, stress, echo, and a carotid. After I got to the ER, I was scheduled for an echo and blood tests. I thought this was not right to tie up the ER with tests. I found out she likes to have her patients have tests done in one place so she can get the results sooner. On Wednesday around noon, I finally had the echo, which showed no blockage. I was discharged on Thursday morning after the hospitalist came in on Wednesday and had me speak to a palliative doctor and maybe see the hospice care doctor. I did speak with a psychiatrist to ensure I was competent to make medical decisions for myself. Of course I was. I wanted a second opinion and was told I could see one of the hospital's doctors. I said I have the name of others and I would need to be discharged to get that number. Then I said maybe someone from Cleveland Clinic. Was told they did not have privileges at SMH. That is when I thought they are just padding my bill. I have now seen another EP who has told me I didn't need that operation going to my heart as the echo showed blockage. I wanted to call the attention to the hospital to let them know that the cardiologist uses the ER for her tests, which I think is wrong. And the hospitalist, well, she just told me they told me I was competent and I did not need to be in the hospital at all. Thank you.
Thank you so much. Jim Tollerton, followed by Sal Coaston.
Thank you. I'm Jim Tollerton, 70-year resident of Sarasota. former board member here. First of all, congratulations on the beautiful new facility. Thanks to Jerry and Karen Kolchowski for a fabulous donation. You guys have done a great job as usual. Thank you for the recognition of Memorial Day, for which Sarasota Memorial is named. Thank you for having the SMA Color Guard. I'm very proud to have been associated with them. My daughter's on the board now. It's wonderful. And the other May recollection is this is the 39th anniversary of the establishment of the Excel Award, which you've continued. And I think Lori's team did a evaluation a couple years ago, and I think she found that 40% of the women in those 39 years either were still employed here or had retired out from Sarasota Memorial, which I think is a wonderful tribute to the hospital and its team. And thank you.
Thank you, Jim. Saul Kilstein, followed by Lisa Roulette.
Hi, I'm Saul Kilstein. I'm from Sarasota. As a point of personal privilege, if you could stop the clock, I'd like to use some of my time to compliment your staff. I recently had some procedure at the ambulatory center, and I'd like to compliment 3 of the nurses there. I don't know if that qualifies for personal privilege, but I would like to compliment Kaylee and pre-op, K-A-L-I, and Kathy and Ashley in the surgical suite. I'd also like to thank Jeff Westner, COO of your Venice Hospital, who put on a suit on Saturday and presented a pitch-perfect overview of the SMH system to about 100 Venice area residents, and it was greatly appreciated. So you can continue with the time. Now I'll go into my usual remarks, which is I've spoken to the board previously about the existential threats facing the SMH system. The House Budget Committee and Appropriations Committees are moving quickly on legislation that's going to reduce Medicare reimbursements, reduce patient coverage through Medicaid and Obamacare changes, reduce government, corporate, and academic investment in research, and reduce timely and reliable information available to hospital systems and physicians. For example, embracing the benefits of measles infection, RFK Jr. has actually encouraged the measles outbreak. He's also said nothing about the growing epidemic of pertussis, which has now killed children in a number of states, nor has he said anything about the over 200 children who have died this season from influenza. These outbreaks are all the result of under-vaccination. The Secretary has also eliminated the entire staff of the Office of Infectious Diseases HIV policy, instituted massive layoffs in FDA, NIH, and CDC, and caused the closure of many vaccine clinics. Again, these are existential threats to the healthcare system that it's going to affect changes in your local community. Incredibly, the Secretary has paused any communications from CDC that aren't public health emergencies. He's restricted CDC attendance at scientific conferences, eliminated presentations to large audiences, and limited updates to CDC websites. This included participating in meetings that would determine what goes in this year's flu vaccine. These are going to affect the demography of diseases that affect this community. It's also going to affect who is insured in this community. So what does this mean for SMH? More uncompensated care, $30 million in the last month, your treasurer just reported. Reduce government reimbursement, reduce government and corporate funded research. You have a wonderful building here. There's going to be less approved research through FDA. That means corporations are going to channel less funded research through this wonderful building, less GME approved slots that it's going to funnel down to this hospital, more difficulty in recruiting the best and brightest staff, higher costs for institutional debt, 10-year bonds have gone up, unknown costs for institutional debt, and unknown spread of preventable communicable diseases in the community. The immigrant population is going to be afraid because of ICE to go to your clinics. They're going to be afraid to get immunizations. And again, these are going to directly impact. These are the existential threats you're going to face, and what are you doing to prepare for it? Thank you very much.
Thank you. Next, Lisa Roulette, followed by Ruth Brandywine.
Before he became our current FDA director, Dr. McCary said the following at a 2023 congressional subcommittee hearing. Public health officials were intellectually dishonest. They lied to the American people. When you really dig into medical guidance coming from federal agencies for the past 5 years, you're going to find a lot of deception and a lot of what some are now describing as depraved indifference to human life. Sarasota Memorial incorporates federal medical guidance, both good and bad, into the foundation of policy here. I have an open request for you to create a plan to examine federal guidance and identify the bad guidance that has at its foundation the lies and deceit that Dr. McCary described to Congress. It sounds like a big challenge, but your responsibility for addressing this recently became divinely easier. One of the top internationally recognized experts, Dr. Pierre Corey, stood before you 2 months ago at the March board meeting and offered to help you. Dr. Corey is so impeccably credentialed that he was asked to provide expert medical testimony in the George Floyd civil lawsuit. He's the co-author of a best-selling, award-winning medical textbook that has been translated into 7 languages. He has testified multiple times at U.S. Senate committee hearings. But most importantly, for our purposes here, Dr. Corey wrote a blockbuster book spelling out the exact ways federal agencies were showing what is now being described as depraved indifference to human life. The voters of Sarasota County selected each of the 9 of you because they believed you would keep our best interests at heart and make sure that if hospital policy were putting us in harm's way, you would call for corrective policy to protect us. I stand here witness that to date, most of you are letting us down. I have been experiencing an unimaginable level of apparent indifference from this hospital board majority. Phone calls are not returned, emails not acknowledged, and serious patient safety concerns backed by official notices from the Florida Department of Health are left unaddressed and unresolved. This refusal to call for corrective policy to protect patients is assigned the name of every hospital board member who remains silent. Americans have been cruelly subjected to federal level medical policy betrayal. I don't want any of you to be part of this betrayal and ask that you confirm with me what next steps look like for protecting us. Thank you.
Thank you. Ruth Brandywine, followed by John Capel.
Good afternoon. This week, as we stay here, the House of Representatives is considering the wonderful bill that will deprive many people of their hospital and health care. There is a proposal to reduce Medicaid funding in a number of ways. One will be to create annual recertifications of patients. When this was done in Arkansas, about 20% of people left, not because of fraud or abuse, but because they couldn't figure out how to apply how to reapply. Maybe their addresses had changed. There were all kinds of problems. A few days ago, Mary Mayhew, the president of the Florida Hospital Association, had an excellent column in the Herald Tribune on the problems of Medicaid and what would happen to the hospitals, specifically the closing of rural hospitals, which depend disproportionately on Medicaid for their patients. A lot of patients in rural areas rely on Medicaid even more than in urban areas. 70% of the elderly in nursing homes depend on Medicaid funding for long-term care. Medicare doesn't pay for long-term care, as you know. Medicaid does. What will happen if these people are deprived? If they're in the hospital and they have to go to nursing home and they can't get into a nursing home, and they have to stay here in the hospital for months? Or are they going to be turned out in the street? Will they be homeless? This is a very serious problem that needs to be considered. And on the bottom line, you know, if people don't have Medicaid, you talked about the bad debt and charity, $30 million a month or something. It's going to go up because more and more people won't have Medicaid, and they will wait until they're very sick and go to the emergency room. And when they go to the emergency room, we, the taxpayers, are going to have to pay the difference. Or you're going to have to take it out of your other funds. The problem is, this needs to be dealt with, and I would hope that this board would take a position and call Representative Stubbe today. You can call as individuals and tell him not to pass this bill. It's not a political thing. It's not a partisan thing. It is the hospital's bread and butter. And I think that your role in taking a stand is urgent at this point. I could go on, but I think I've made my point. And, I don't want to take more time than is necessary. I hope you will seriously consider taking a position. I will. I've been calling him, and many of my friends are calling his office. They have to make a record of phone calls. So it's important that they hear from us. After the House passes or not passes this bill, it will then go to the Senate. And senators have said they will probably make some changes. We'll see what happens at that point, but something's going to come out. And by the way, this is all so that the 2017 tax cuts can be permanent, which would cost about $3 trillion added to our national debt over 10 years. So there's like an assumption we have to cut Medicaid so that we can have this tax cut. I'll leave it there. Thank you.
Thank you so much. John Capel.
Hi, I'm John Coppell from Sarasota. Thank you for letting me speak. First of all, I want to congratulate and thank Bobby Kennedy for the job that he's doing at HHS, exposing the corruption and the ties between big pharma and the medical establishment. And this will save lives, contrary to what some previous speakers said. And why is it that, and this is what Bobby wants to do, I'm in direct contact with him. He wants to have a double-blind study between vaccinated and unvaccinated individuals, children, because no longer can you say vaccines are safe or effective. They're not. The rest of my comments refer to what the actions taken by the hospital during the pandemic. What's the difference between a hitman and a hospital? A hospital can kill. A hospital can kill a lot more people than a hitman, and hospitals get paid a lot more money. Also, due to the unconstitutional and sinister PrEP Act, hospitals and doctors are legally protected from their evil actions. But God sees everything and remembers everything. We will all have to face our karma sooner or later. We know how you did it with a fake PCR test that was intentionally manipulated to produce a false positive. Even the creator of the PCR test, who won a Nobel Prize, Kary Mullis, said it should never be used as a diagnostic tool. He conveniently died right before the pandemic. Or your use of remdesivir, even though in the original clinical trial, 53% of the patients or guinea pigs died. Or your use of ventilators, often against the will of the patient and family, even though you must know that 85 to 90% of people put on ventilators die. You wouldn't allow other safe and effective alternatives, such as FDA-approved ivermectin, vitamin C, or other therapeutics. You pushed the COVID bioweapon, also known as the COVID vaccine, on your patients with or without their consent. You did this even after Florida Surgeon General Dr. Ladapo called this so-called vaccine a bioweapon that should be banned. According to the VAERS database, which dramatically understates the figures, there were 38,000 deaths due to the COVID bioweapon and more than 2.6 million serious adverse effects. And by the labeling of that so-called vaccine, which destroys the human genome, Dr. Francis Boyle, the lawyer who wrote the 1986 Bioweapons Treaty, adopted unanimously by the U.S. Congress, when have you seen that, said this is a bioweapon. The COVID shot is a bioweapon. 38,000 deaths, 2.6 million serious adverse events. And you know these figures are dramatically understated because you pressured your doctors and staff not to report to the VAERS, which is required by law. You refused to allow an independent study of your actions. Of course, all this is not surprising, considering how many millions of dollars you received from the federal government for following their orders, just like the Nazis did. Oh, I was just following the government's orders. Oh, I was just following the CDC. Oh, I was just following the FDA. There are multiple ongoing state and federal lawsuits to hold vaccine makers, hospitals, and doctors liable for their actions. There are also criminal charges being pursued. A lawsuit filed seeks to strike down the PrEP Act, the federal law that granted legal immunity to vaccine companies, hospitals, and doctors. The lawsuit filed in the U.S. District Court for the Middle District of Florida, Tampa Division, alleges the PrEP Act violates the U.S. Constitution and the Administrative Procedure Act. And there is ongoing criminal investigation in Oklahoma, criminal, against the hospital and a doctor for the grievous harms they committed during the pandemic. The proposed charges include negligent and reckless homicide. The house of cards is coming down. Eventually, SMH will have to face the music, and it won't be Bach or Beethoven.
Thank you, everyone. Having completed our agenda, and I have no other items on the agenda, we will adjourn the meeting. Thank you. Have a great day.